Hi everyone, this is Dr. K. Saketh, Consultant Orthopedic Surgeon at Gleneagles Hospital, Lakdi-ka-pul. I am specialized in Regenerative Orthopedics, sports surgery and joint replacement surgeries. Today I am going to talk about Regenerative Orthopedics. It is entirely a new subspecialty of orthopedics in recent advances. So Regenerative Orthopedics includes procedures for faster recovery of the patients for cartilage, muscles, tendons, joints and ligament injuries, more focusing on cartilage injuries and for osteoarthritis of knees in stage 1 and in stage 2 levels. These regenerative orthopedic procedures would be highly beneficiary to the patients. So there are various types in these cartilage repair techniques. So they may be palliative, meaning pain relieving procedures, or they could be reparative techniques or regenerative or restorative techniques. So if the patient has more pain, so what we do, all these surgeries are minimally invasive surgeries. So the patient would be having very minimal pain, and with only 1 centimeter of incisions, of 2 incisions, we would be doing these surgeries arthroscopically. These are also termed keyhole procedures. So all these are daycare surgeries and the patient can be discharged in the evening or the following day in the morning hours. So the palliative surgeries, we go into the joint, we see through a camera and we give a clean wash, and wherever there are flakes of damaged area, we will be removing those damaged tissues. Coming to the reparative procedures, where there is osteoarthritic changes, what we do, at the defect area, we do small drills so that the bone marrow is stimulated and then fresh cells ooze out and they repair the damaged tissue. Recent advances, if the defect is more, so we use something called as bioscaffolds, meaning a small sponge-like materials where we mix with bone marrow aspirate concentrate, which are rich in stem cells, and then we cover the defect area mixing with fibrin glue. If the defect is far more, then we need to go for cartilage transplantation. So meaning we take cartilage from an area and then we transplant it into the defected area. And then if the patient is not willing for, or if the defect is far too high, then we use the transplant material, we harvest it from bone banks such that we use multiple plugs. So there are something called bone banks similar to eye banks and blood banks where the cartilage along with bone plugs are preserved. So we order for these and then we utilize for cartilage transplantation. And then if the patient doesn't want knee replacement also, so what we do is that for functional recovery, for pain relief, these procedures, arthroscopy procedures, are also done to postpone total knee replacement. So for osteoarthritis patients who are in stage 1 and stage 2, these procedures are highly successful. And then coming to other sports injuries patients, there is something called platelet-rich plasma and bone marrow aspirate concentrate therapy. So we take blood from patient and we isolate platelets and then we inject directly into the joint or where the damaged tendon or ligament or muscle is damaged. Sometimes we take bone marrow aspirate concentrate, which are rich in stem cells, from area above the hip joint, that is called iliac crust, and then we, through a centrifuge, we isolate rich concentrate which is highly concentrated in and rich in stem cells, and we directly inject into the damaged area or into the joint. If the patient is not even willing for this minimally invasive keyhole surgeries, then these procedures can be done such that they would be beneficial to the patient. PRP therapy usually takes 1 to 3 sessions, and then bone marrow aspirate concentrate usually takes 1 session. So after all these procedures, patient functional outcome would be far better, and then their quality of life is also improved.